Anti-inflammatory diet is really quite an interesting concept. This idea actually started from a group of diseases called autoimmune diseases, whereby our antibodies, our immune system actually attacks our own body, triggered by something in individuals who have this tendency to have an abnormal immune system. So therefore, since inflammation caused by the immune system can cause damage, a lot of people are thinking maybe we can identify foods that in the general public will also cause more inflammation, and if you reduce these consumption of these foods, then maybe we will have less inflammation and ultimately longer longevity. So what do you want to avoid? Highly processed foods, especially those which are high in fat, high in simple sugars, and also preservatives. The thinking is that some of these processed foods have high saturated fat that causes the body's LDL or low density lipoprotein to increase, and this can trigger an inflammatory response both within the arteries of our heart and other places. Certain other foods like simple sugars, preservatives have also been implicated to cause inflammation within our body. Lastly, there's also a concept whereby our gut bacteria sometimes can translocate, which means to go from, generally it doesn't occur, but sometimes it can translocate from our gut into our body, causing inflammation and other illnesses, and certain foods taken in trace amounts can increase this. So therefore, reducing these kind of foods generally is thought to reduce inflammation. So what are they? I mean, potato chips, highly processed foods, simple sugars, and a lot of things that you generally shouldn't eat. Then, what are things to increase? So things like fiber, things like omega-3 fatty acids. So omega-3 fatty acids, that's fish oils, So I think fiber is actually good to increase the amount of roughage that we have within our gut. It's also said to reduce the permeability of bacteria. Remember I said the gut theory. It also morphs out some of this saturated fat. Makes us feel full, so we don't eat so much. Fish oils also are known to reduce the level of LDL, and by that matter reduce the inflammation and also the chance of heart diseases. If you were to have low amount of processed foods, less preservatives, less saturated fat, less sugars in your diet, and you have increased amount of omega-3s and fiber, what do you have? You have a really healthy, balanced diet. So why not? Yeah, having a healthy diet, in this case an anti-inflammatory diet, or some people actually even call it a Mediterranean diet, will lead to a healthier lifestyle. And if this anti-inflammation theory is true, then you have two benefits. You have got a healthy diet and you have got less inflammation as well. It's still not proven, but in my view, if you have a Mediterranean diet, or in this case an anti-inflammatory diet, it's generally good both for weight loss, because you reduce the number of calories you consume, and reduction in risk of cardiovascular illness, heart attacks, strokes, reduce the chance of lifestyle-based cancers like colon cancer, breast cancer. Why not? If the anti-inflammatory theory proves to be true, then that's a plus. So having weight loss is probably something that you can expect if you have a good anti-inflammatory diet. This is Dr. Terence Tan saying goodbye.